Welcome back. So I would say that a fairly large percentage of the client population that I see, what I said in the intro is exactly their particular situation. And the reasons, as far as the symptoms that they may be presenting with, can be varied. Maybe it's thyroid symptoms, maybe it is gastrointestinal symptoms, maybe it's skin situations. In fact, I would say that those three are the most common. Whatever it is, they basically just say the same thing. They've been dealing with this situation for years. They've been to many different physicians. They basically tell them either they're doing as much as they can, or they can't even find anything that's particularly wrong with them, or they have even gone through certain surgeries. Maybe they have their gallbladder removed or something like that, and they still have the same set of symptoms that unfortunately they had the surgery for. So what do you do in these types of cases? Well, obviously you come see me. No, all kidding aside, well, you can do that, but all kidding aside, let's talk about some of the things that you do. Well, obviously, if the medications, if the surgeries, if the labs that the physicians are running on you, if you have these particular sets of symptoms and they're coming back normal, or they're not really finding anything majorly wrong, or you're taking the medications that are recommended and it's not having a huge successful difference, then perhaps the underlying cause, the foundational cause, is not being addressed at all. In fact, it's not perhaps. I would guarantee you that is what's happening. So let's just break it down. What is the very first thing that you would want to consider as far as what could be contributing to the situation that you're having as far as an actual root cause? You see, when I work with clients, I never address their symptoms. Doesn't mean I'm not concerned about their symptoms. It just means that I never address their symptoms, because that's what's been happening to them the entire time that they've been having a situation, a problem. So if they're in my office, that approach hasn't gotten them anywhere, right? So we need to stop worrying about the symptoms that a person may be presenting with and start worrying about or creating the environment, both inside and outside of their body, that is conducive to creating health, to creating well-being. Let's concern ourselves about that. So all of the suggestions that I'm going to be giving to you, that's what it is designed to do, is to help you create health and vitality, both internally and externally as well. So first thing, it's always the thing that I harp on, and that's diet. Now, it's almost a given that you should remove the things that are most common to create situations of any kind, health problems of any kind within the body. And those categories are grains and sugars. Any kind of grain, any kind of sugar. It does not matter if it's a natural sugar. It doesn't matter if it's honey. Many people don't even realize that's a sugar, which is kind of interesting when you think about it. It doesn't matter if it is raw. As far as sugar is concerned, it doesn't matter. Sugars, they are consumed far too frequently, and if you're consuming more than 10 pounds a year, which I guarantee you are probably 20 times that, that is far too much, even though it may be the most natural sugar on the planet. It's a problem. Also lump alcohol within the sugar category, because basically your body treats it just the same as sugar as well. Going back to grains, it is any grain. It's not just gluten or gluten-bearing grains. It's any grain. It could be rice. It could be oats. We'll throw corn in there as a grain. And sometimes it can also be alternative or quasi-grains that people consume now, because they're familiar with the idea that grains can create problems. So what are kind of the quasi or alternative grains, if you will? Well, it could be not a grain of any type at all, which is nut flours. So like almond flours, they can start causing an issue, especially if you tend to have a digestive one. Nuts in general can cause that, including peanuts, which is not a nut at all, it's a bean, so just keep that in mind. So nut flours, if you have switched or transitioned away from any type of grain and now you're using an almond flour or something of the like, instead trying to stay away from the grains and you're still having problems, realize that nut flours can be pro-inflammatory to the bowel and really to anything else as well. It's just most commonly found within the bowel. As well as things like cassava. I often find cassava flour root to start becoming an issue for an individual. So they may have previously done okay with it, or I may have tested them and their body says, yeah, there's not a problem. And so then they start consuming a lot of it. Maybe it's a bag of cassava chips a day or a few a week, or not only are they consuming the cassava chips, but they're also using cassava flour and other things. It's too much, people, all right? If you start consuming too much of a single thing within a certain given period of time, it doesn't matter how good it is for the body, you can sensitize yourself to it. So be aware of that. So it doesn't stop there. It could also be coconut flours, or going back to the sugar category, coconut sugars as well, because a lot of people use that thinking that is more healthy, and it is more healthy than overall processed sugar, but it typically creates a problem as well. So that is a huge area that needs to be looked at. Now, it's also important that you start looking at the underlying physiology that may be behind it as well. So let's go to thyroid symptoms. So if you have thyroid symptoms, you've been to a physician, they run a lab, a routine thyroid panel, and everything comes out great. They say you're within range, but you still feel like shit. Something is going on, right? Something is occurring. Let me go ahead and turn down my audio because it seems to be extremely loud. Okay, hopefully that's better. So maybe we should look at, it could be a different aspect. For example, in the world of thyroid problems, it may be that a routine thyroid panel just doesn't show up what's going on. What I mean by that is that very frequently primary hypothyroidism, as an example, can be caused from an autoimmune disease called Hashimoto's. That is one of the most common thyroid disorders now, certainly within the Western world, United States, and among females. Running a routine thyroid panel will not show if you have Hashimoto's or not. There's a specific antibody tests that have to be run in order for that to be found. Now, the reason that typically physicians don't run those panels is that if they were to find that, there's not really any change in what they are prescribed as treatment, meaning it's still going to be a thyroid medication. So if especially you are already on thyroid medication, your thyroid panels are normal on that thyroid medication, but you're still having thyroid symptoms, they're not going to do anything further. I mean, they may give you an antidepressant and say it's all in your brain or all in your head. That's going to be the next thing they do, because there's nothing else that they can do, even if they were to run other labs and find that there is a problem, such as Hashimoto's. They're still just going to give you thyroid medication. So what we do is, again, not worry about the symptoms. We want to look at the root cause of any type of health situation within the body, and that's just simply a lack of overall good health and vitality. We want to create those things, right? So that's what we start looking at. Let's look at the similar idea as far as in the case of digestive disorders. Now, it could be irritable bowel, it could be Crohn's, it could be colitis, any of those bowel types of diseases. It could just be really chronic constipation. So it's oftentimes, in the cases of the digestive system, not a primary digestion problem. I mean, within the organs of, like the intestine or the small intestine or some organs like that. One of the common functional medicine trends that's occurring right now is something called SIBO, S-I-B-O. That's an acronym for small intestine bacterial overgrowth. That's thrown about everywhere. Sometimes that's an issue. I have found that it's not nearly as frequent of an issue as many people think that it is. Just saying it can be, but don't think that if you have a bowel issue, and because that's kind of the trending popular thing right now, that's going to be the solution. Because then a person tries to go through the different kinds of nutritional protocols to help with that particular situation, and even though they may have symptoms that are similar to it, they don't really improve because it's not that situation. In the cases of irritable bowel types of disorders like ulcerative colitis or Crohn's, or different kinds of really irritated, inflamed bowel situations, oftentimes what you have to do is look towards the kidneys, and the kidneys just need to have overall health improvement. Again, we come back to the idea of improving the overall health and vitality of the body, and it's amazing what sets of symptoms just simply disappear and you're not even paying attention or concentrating on any of those symptoms because we're improving the overall health of the body. So a flip side of looking at that is what? It's that if you're coming in with any type of symptoms, it doesn't matter what it is, it doesn't matter if it's just bloating or belching or frequent hangnails, whatever it may be, it means that there is a part of your body at least that is not to the optimal level of health. Because no symptom within the body is normal except good health. That's normal. So if you're having anything besides good health and vitality, it's not normal. That doesn't mean that you don't have a set of symptoms. So if you're fatigued, like between the hours of 3 and 5 p.m. in the afternoon all the time, but you don't feel bad, you're not throwing up, you're not, having brain fog or something, that's still a sign that the body is not functioning to optimal levels. Okay? Kind of got sidetracked, but just keep that in mind. So realize that there are many different components to a certain set of symptoms that you may be experiencing. Same thing for skin disorders of all kinds. It could be from rosacea to psoriasis, which is obviously an autoimmune disease. But many people, instead of taking a really detrimental form of medication like an immunosuppressive drug to keep those symptoms at bay of the psoriasis, they go and look for the food allergies that they may have, or maybe it's a chemical sensitivity, or maybe again it's a less kidney function, optimal kidney function than they should have. And when they improve those things, they start noticing that skin, even if it's psoriasis or other kinds of autoimmune situations, just happily start improving. So I encourage you, if you are in a situation in which you've been to physician after physician and it's either not improved, or they say we can't really find anything wrong with you, all your labs are normal, and you still feel like crap, to start looking at creating an environment internally and externally that promotes health, that promotes vitality, and you will be pleasantly surprised that those symptoms can just fade away. Now, in fact, I want to show you how that is actually true in the case of a recent client of mine who is very kind to leave a review. Let me see if I can. I'm going to have to put this, just hang on for 1 second. I should have already had this set up, but I didn't, because that's just the way I am. Hold on. Right here. Okay, so we're going to go to the screenshot. This is of a recent Google review of a client. Again, very kind of him to leave such a fantastic review. But he had found himself in a situation very similar to what I'm describing. And that is that he'd been to a physician or physicians, I should say, for a couple of years, been dealing with some major situations. And then we started working together, and quite happily, his symptoms started improving. So overall health. We're not concentrating on these symptoms, and we're not, that's not our primary interest, right? We're interested in improving his overall health, and in doing so, we want to create wellness and vitality internally and externally. His body knows what to do. His body is the one that is healing him. It's not anything that I'm telling him or anything that I'm giving him. It's his body, regardless of what tools are being used, that has the final say in the matter. And that's why he's having such excellent results, because his body is being given, at this point, finally, what it needs. So that's just one example. You can actually go to our Google reviews. We have well over 90, almost 100 Google reviews, 5-star Google reviews, and you'll find it very interesting what people have been experiencing in working with us. So, if you're finding yourself in that kind of situation, and even after following the things that I've suggested today, you're still having difficulty, then I invite you to call our office, set up an initial consultation, and at that initial consultation, I'll be able to identify with you if we can help your situation or not. And if we can, we will create a total health restoration program, which has a primary concern or interest in creating this health and vitality. And hopefully, all those symptoms just fade away. So you, again, can call our office. You can also go to our website, which is healthrebel.tv, www.healthrebel.tv. And if you're interested in these types of videos, you can also like our fan page both on Facebook and also our YouTube channel. Like and subscribe. And one more favor, if I can ask that of you, and that is, if you have found any of this information useful, please at least like our video. And even more so, that would be helpful, is to share this video with any of your friends or family on your timeline, because that really is the only way now that we are able to disseminate this information to anyone. Because by this time, over the last 2.5 years, these social media platforms are locking all kinds of very useful, very important health information. They're locking it down. And we just do not get anything of the reach that we should be getting. And it helps us a lot, even just liking our video, but especially if you are to share it. So thank you very much for watching today. Again, my name is Labron Allen. I am the founder of the Natural Health Clinic. Take care.